major surgery or anesthesia. And what really means is they can really recover very fast and get back to the normalcy as very fast as they can. Okay. So one of such treatments we provide is called uterine artery embolization, which is what we're going to talk about today. Okay. Just before we talk about the treatment itself, let's look at what fibroids are. So uterine fibroids are lumps that grow on the uterus. As you can see on the picture here, they can grow. This is the uterus, you can see, and then you can see multiple whitish pink lumps shown in the picture. These are the fibroids which happen in the body. And these fibroids can either happen in the outer wall of the uterus, or they can happen in the inner wall of the uterus, or in the center of the uterine wall. And these are called fibroids. And basically, first thing to tell, these fibroids are not cancer. These are just lumps which happen due to overgrowth of normal uterine tissue, and they tend to slowly grow in time. And the main reason why they occur is it's not due to the imbalance of the female hormones, which gets secreted naturally, but when there is an imbalance of it, tissues tend to overgrow and form these lumps. And also they attribute it to some genetic factors, meaning if a mother has it, then the daughter or her related cousins or sisters can also have this problem. Okay, so how common is this problem, fibroids? So fibroids actually a very common problem in young women, and statistics show that 37% of Indian women in the age group between 20 and 40 years, and 57% of women in the age group between 40 and 59 years have fibroids, which is a staggering number actually, which really almost equates to like almost 1 in 2 women between 40 to 60 years have a fibroid. But the good thing about it is not everyone suffers from symptoms due to fibroid. Okay, but a fair majority of them do have problems due to fibroid. And let's look at what the problems are. So here is a pictorial showing what the symptoms of fibroids are. And we can basically divide them into 2 components. One is fibroids can directly affect the physical health, which we'll be looking into a bit detail, and can also cause emotional stress or mental health problems. So let's dive in. So the first number 1 complaint patients come to us when they have fibroids is disturbances in their periods. They can have very heavy periods, which means they have very heavy flow, or they get passing clots, or the period cycle or the periods are lasting much longer than usual. Is a normal expected range of the period to last is for 3 to 5 days. But for some women, it can go on up to 10 to 15 days, which is quite a lot of time. Or they can have very painful periods. Generally, women have some discomfort in the abdomen before their period or during the period, but the pain that happens when they have a fibroid is quite bad that they're not able to even do the normal activity. Sometimes they end up taking leave from work. A lot of my patients tell that I end up taking leave on my 2nd day or 3rd day because I can't bother to get out of bed. So it can be very bad pain. They have to take painkillers and they stay curled up in bed. And that's what they exactly tell me. The pain can be in the lower abdomen, can be in the lower back, or sometimes they say pain is a dragging pain in the legs. And some of our women do sort of neglect these heavy periods. And what happens is over time, they tend to lose a lot of blood over time. And what happens is they become very anemic, as in the hemoglobin level in the blood drops significantly, almost to half the normal levels. And then they start feeling very tired. They are not able to do their normal activities. They're getting very breathless when they walk up the stairs, or they feel tired and sleepy all the time, doesn't have the initiative to do their normal duties. And that can be a common problem as well, anemia. And then next we have symptoms, what we call as pressure symptoms. What it means by pressure symptoms is some patients don't have problem with their periods, but these fibroids are sitting in there and slowly growing over time, and they can get quite big, up to even 10 to 15 centimeters in size. The biggest fibroid we treated is almost a lady who had a fibroid which was like almost 18 centimeters in size, which is growing above the level of her umbilicus, and she had a big bulge in her lower abdomen, and she was almost looking like 4 months pregnant. So that's what can happen. Some of the women put up with these symptoms without looking into their health care. And so because of this, they can have pressure symptoms. What it means by pressure symptoms is they can have feeling a sensation of bloating all the time, or they can feel a low backache because that fibroid is pressing on the lower back, and they have a lot of low backache. Sometimes they don't realize it's due to the fibroids. When they come to us for consultation, when we ask them, do you have low backache? And they say, actually, doctor, yes, I've been suffering from this for a long time, but I thought it was just me. And they don't seem to link up the causes. So they can have that. Or when the fibroid is pressing on their urinary bladder, which is in front of their uterus, they can have a problem called urinary urgency, which means that the moment they get the sensation they have to pass urine, they have to rush to the toilet. They can't hold it for long. Or they end up going to the washroom quite frequently than others because there's a constant pressure on the bladder. So the capacity of the bladder is very less, and it's also irritated. And secondly, they can have a problem called constipation because, again, the uterus can press on the bowel, which is behind the uterus. And the pelvis is a very, very small space. So the moment the uterus starts growing big, it starts pressing on all the other structures next to it. As I said, the bladder, or you can press on your bowel. So they can have constipation, or they can feel very gassy and bloated. And some of the patients say that they just felt it's just them. And it's they couldn't really link it up to the fibroids. And one other common thing which can happen in younger women who are trying to conceive is when the fibroids are too huge, they occupy most of the space within the womb. So they have difficulty in conceiving a baby. So it can be a cause of infertility too. And lastly, I also mentioned about the emotional component. Now you can see, after having told you about all the physical components I told you, that can directly lead to, that's enough to cause enough emotional stress for these patients because, one, they're having a prolonged period and they're having heavy pain and they're having difficulty conceiving. And all these can directly lead to emotional stress and mental stress, and they're not able to do their normal activities. We had a patient who came to us. She's a 42-year-old woman who's a teacher working in a very renowned Orthodox school in Chennai. And she's been having this problem with fibroids. She had a fibroid which is almost 10 centimeters in size, and she's been putting up with it for nearly 5 years. And her problem was heavy periods, which means a lot of flow, as well as the period lasts for nearly 15 days. I couldn't believe. And she told me, yeah, she said, yes, doctor, it lasts for 15 days. That's almost half the month. And then periods finishes, and 10 days, again, she starts her periods. So you can see she was, because she had heavy flow during the periods, she slowly avoided going out when she had periods, as in going to social events or attending, going to public places, or even traveling in the public transport, because she found it like she may have an embarrassing moment. So she tried avoiding these things, and soon she was finding herself restricting herself to a home all the time. And she found it very difficult at work because she became very anemic, and she found that she couldn't climb a flight of stairs without getting breathless. And all these physical problems and this emotional isolation was also putting a lot of stress on her mind. And even at work, she found that because she's been having the periods for a long time, and it's a cultural stigma in the Indian culture, people were avoiding her, and they wouldn't sit down to have lunch with her or share her food with her. She was going to have extreme amounts of emotional stress due to this problem. And we found that her physical symptoms were much more, but she felt her emotional stress was much more compared to the period problems she was having. So that's the amount of disturbances in their physical and mental health women go through when they have fibroids. Now, what are the treatment options when it comes to fibroids? When they go to most physicians or gynecologists, when they go for when they have fibroids, most of them, when they come with this heavy periods, they will have an ultrasound scan of the pelvis, which will easily detect they have fibroids. And the next treatment they offered is only major surgery, where they do a surgery to remove the entire uterus out of the body, which means it's a big scar in the abdomen to remove the entire uterus, and it's a big surgery. Or in some patients, they may choose to do a surgery where they'll just remove the fibroids from the uterus. So needless to say, both are open surgeries, which will require general anesthesia, and they have lots of post-op pain. They end up staying in hospital for up to a week. And then the most important thing for young women is for them to get back to their normal activity, to the initial state where they were in. It almost takes 1 to 2 months, which is simply not acceptable to women at this day and age, where they're working, taking care of the family, having a nuclear family. They find it very difficult to have support system to go through this surgery. And because of this reason, we find a lot of women who come to us have been postponing the surgery. They have been told by many doctors. They go from doctor to doctor looking for any other treatment option, but they're all told surgery. So they just keep pushing off the surgery and just putting up with these problems for a long time just because they don't want to go for surgery. And other treatment is hormone tablets. Sometimes give us temporary relief from their periods, but the moment the tablets are stopped, all the problems come back to them. And also, as I said, these hormone tablets again can cause problems because fibroids happen in the first place due to hormonal imbalance, and we're trying to use hormones to treat this problem as well, which doesn't make sense. So these are the current treatments that are generally offered for fibroids, and they are not acceptable to all our patients because that's what we see when patients come to a clinic. They are not happy with having a hysterectomy done. Some women also feel very strongly that they identify the uterus as part of the femininity and they just don't want to lose it. Okay. And one other long-term complication of hysterectomy, which many people fear about, or which puts off from surgery, is the long-term consequence of having a hysterectomy. The uterus is sitting on the pelvic floor and it's attached to all the pelvic muscles, the floor muscles. And the moment they remove the uterus, what happens is they develop a weakness of the pelvic wall, the floor. And what happens is later they can have problems like prolapse. They can have prolapse of the bladder, the caudal irakam, they can have prolapse of the bladder or the rectum, and they can have problems with this, or they can have urinary incontinence as well. Sometimes they cough and they're passing urine. And that happens accidentally because the pelvic floor is very weak. And this happens very commonly after having a hysterectomy, not immediately, but after a few years. So if a woman has a hysterectomy at 40, and probably by 50, she is having this problem, she suffers with this until the end of her life, which is very significant problem to undergo. So what do we do at MEOT? So at MEOT, we offer a pinhole procedure for this condition called fibroids without opening the body and without removing the uterus. So here we have a schematic of what we do. So when patients come to us with fibroid-related heavy periods or pain or whatever reason, we will assess them. We do an ultrasound scan to confirm it. Most of the women already know the diagnosis because they've been putting up with this for a long time. So what we do is we admit them for a day. We do this procedure where we make a tiny nick in the groin and the top of the leg. This we do under local anesthesia, which means we give a small injection in the groin to numb the area, and then we put the tube inside. And then under X-ray guidance, we carefully pass this tube into the blood vessel which supplies the uterus. And this we can confirm by injecting a dye. And this is called an angiogram. Angiogram is just a common terminology for taking picture of blood vessels. Now, when we mention the word angiogram, people generally identify it with the heart because that's where it's commonly used. But angiogram is a general terminology for any picture of blood vessels. So we can take picture of the blood vessels of the uterus to confirm we are there in the right place, because the pelvic organ, there are a lot of pelvic organs and there are a lot of blood vessels there. But we carefully identify the blood flow to the uterus, and then we push a tiny catheter further close to the arteries which supplies the fibroids. And then we inject tiny plastic beads. And these plastic beads, what they tend to do is go along with the blood flow, and they block the tiny blood vessels which are supplying the fibroids. Generally, when we have a fibroid in the uterus, what happens, we notice, is compared to a normal uterus, most of the blood is sucked in by the fibroids because they want blood supply to grow, survive and grow. So any organ needs blood flow to survive and grow. And because these fibroids are slowly growing and they are much more active than normal uterine tissue, they tend to grow and draw much lower blood supply to them. So when we block the blood supply, what happens? We all know that all parts of the body needs blood flow to survive and grow. So the moment you block the blood flow to them, these fibroids die and they shrink in size. And what is the result for the patient? For the patient, from the next period on, their cycles are much lighter and their period pain goes away, and all the symptoms related to the pressure symptoms slowly get better because these fibroids, once they die, the body tends to remove the dead tissue. That's the function of the normal function of the body. Anywhere there's dead tissue or dead cells, the body will remove it. So the body will remove the dead cells and these fibroids shrink in size and patient gets relief from the symptoms. And this, I want to reiterate that this procedure only affects the blood flow to the fibroids. The rest of the normal healthy uterus remains as it is without being touched. So that's why this is also a very good treatment for women who are having infertility issues due to the fibroid. Now, women may have infertility issues due to a lot of reasons, but if it's mainly due to fibroids, this can be a good treatment because the normal uterus is untouched without any scar, and they can go on to have a normal pregnancy. So I'm going to show you a small animation cartoon of how this procedure works. As you can see, the fibroid is shown in yellow color, which is sitting in the uterus there. And then from a tiny pinhole access in the groin, we are advancing this yellow catheter, and the catheter goes all the way into the uterine artery, and these plastic beads are being released, which blocking the blood flow to the fibroid. And over time, these fibroids are shrinking in size, get smaller, and then a patient gets relief from their symptoms. And the fibroids, what happens is, they sometimes ask me what happens to the fibroids. The fibroids stay inside, but they shrink in size and they become like a scar. They don't cause any more problems, and they don't tend to grow back, because once a blood supply is cut off to something, it just dies. So there's no chance of it coming back. So just to give you an overview of how immediate post-op pictures will look in a patients who had a hysterectomy, open hysterectomy, which is like a long scar in the abdomen here. And some people can have laparoscopic hysterectomy, where they put keyholes and remove the fibroid. But this can be done only in patients who have very small fibroids. If they have a very huge fibroid, like 6 or 8 centimeter fibroid, this procedure won't work, because they are also operating through a keyhole, and it's simply not possible to remove the entire big uterus with using the keyhole. So they have to do an open surgery. But very small fibroids, they can remove through a hysterectomy scar, but still, nevertheless, you still have a few scars, like 1-inch scars here, at least 3 scars you will have in the abdomen. But you compare to a patient who went uterine artery embolization done a day ago, all you see is like a tiny scratch, like a mosquito bite. And 1 week later, you can't even identify the scar. That's the benefit of uterine artery embolization, where you can do the surgery through a tiny pinhole and you don't end up with any scar whatsoever. So what are the advantages of doing this procedure? We already talked about a few. So it's a pinhole procedure, and we don't leave any scar in the abdomen. Most important for many women, we preserve the uterus, we preserve their fertility. They don't feel like they have lost their femininity because of this problem. And because once you lose uterus, you hit menopause immediately, right? So because you're 40 and you may be going on for another 5 years with your periods, but the moment you remove your uterus, you just hit menopause straight away. And because we do the procedure through a very tiny pinhole, there is no need for general anesthesia. That's a different topic. Anesthesia itself, general anesthesia itself carries risks, major risks, and that's why some patients who have other medical problems may not be fit for general anesthesia. But in our procedure, we do it under just local anesthesia, just like the dentist. So there's no need for general anesthesia. And because our procedure is very short and very minimally invasive, we send the patients home within 3 days after procedure. So just after 3 days, they go home. And after 5 days after the procedure, they are back to the normal life. Yes, you heard it, just 5 days. After 5 days, they go back to the normal life. There's no restrictions on showering or lifting heavy weights or anything. They just can go back to the normal life. And needless to say, because there's no major cut, no major no disruption of the body structures, it's much, much safer than surgery. So I want to show you a few cases of patients who we treated at MIOT. So this is a lady, a 45-year-old businesswoman from Coimbatore. And her problem was she had heavy periods for the last 2 years. And it was so heavy that she would be passing clots and having dragging back pain. And this prevented her from going out of her house to work during a period's time. She would take off her work. And as a businesswoman, her work involved a lot of traveling, meeting a lot of potential customers and all. So this meant that at least 1 week of the month, she's out of her business. She can't run her business. So it's really affecting her life. And she went to many gynecologists in and around Coimbatore. And the only suggestion given to her was to have a uterus removed. But she was not keen on having a uterus removed. And actually, she told me that one of her gynecologists was a really close family friend. And she went and asked her gynecologist, "Doctor, I read about this treatment called uterine artery embolization. Can I have it done? Will it work for me?" And the gynecologist just told her, "No, your uterus has got a very big fibroid, and this won't work for you because that fibroid will not be, cannot be treated because it's so huge," which is wrong. So she, despite that, actually, she had gone on to book her, operation date with this gynecologist because she thought there's no other option. And this gynecologist is telling me that, no, this can't be treated by this embolization procedure. But one last chance, after she booked a surgery date, she traveled to Chennai, met us at MIOT, and showed her scans and everything. We told her, yes, we can treat this. This can be treated as well by, the uterine artery embolization. And she underwent the procedure, and she had a period exactly 2 weeks after the procedure. So she called us from Coimbatore, and she was very elated that her periods had gone down to literally 20% of what it used to be. And it only lasted 3 days compared to the 7 days it used to last. So she was very, very elated that she can go back and do all the normal activity without any restrictions just due to these fibroids. And we have her scans here just to show you guys. So this is her scan, MRI scan, which was done before treatment. And you can see the large fibroid sitting in a uterus. And she also had symptoms due to pressure symptoms on her bladder. She can't hold her urine for a long time. And she also had bloating in abdomen. Also, she had felt a bulge in her lower abdomen getting bigger and bigger. And she just thought she was getting fat. She didn't realize it's the fibroid pushing in front, causing all these problems. And this is her scan 6 months after treatment. You can see the fibroid has shrunk in size significantly. Also to note that there is a slight difference in shade of gray you see. The fibroid after treatment looks a darker gray, and here it looks like a lighter gray. All that means to you guys is this fibroid is dead. It's completely dead, and it's slowly shrinking in size. I guess if we do a scan for her now, that will be even more smaller. So basically, we cut off the blood supply to the fibroid without opening it up, and that kills the fibroid, and the fibroid completely shrinks in size. And they have problem with periods pain or periods, heavy periods, that gets relieved immediately after surgery. And she could even notice her bulge in the lower abdomen getting smaller. Actually, you can see in this picture, you can see the front of the picture, the skin, there's a little bit of a bulge pushing forward, but here you see the line is straight and it's like flat. And she was happy that her tummy was also getting smaller because of this treatment. Next, I want to share with you a history of an interesting patient. She is a 44-year-old IT professional working in Chennai. She, more than an IT professional, she's a very avid fitness enthusiast. She regularly does jogging, cycling, and even weight training. And she rides cycle for almost 100 kilometers on the weekends. She does 100 kilometers of cycling every weekend. And she noticed that she is having a lot of pain in the lower abdomen, the bulge. And then she was noticing that when she goes on cycling with a group, she has a group of people, women and men, who go cycling along with her. She noticed that she had to take frequent toilet breaks compared to all her female colleagues who came along with her. And she also noticed she having this lower abdominal pain and back pain. And she went and got scanned, and she found out that she had fibroids. And again, she had very big fibroids, which would explain all her symptoms. She didn't have heavy periods, but her problem was back pain and urinary frequency, and it can present in different ways. So her problem was that. And then she again went to the gynecologist. She visited gynecologists in 3 different hospitals in Chennai, and all of them told her unanimously, you go for hysterectomy to have your uterus removed. But this lady, being an IT professional, she had done all her research on the internet about what the possible treatment options are, and she came to her treatment. She clearly told us, I don't want to have a hysterectomy. I don't want to lose my uterus. And she also knew about the side effects, long-term side effects of pelvic floor weakness, which can happen after surgery, which can be very, very limiting for her, being an avid cyclist and a weight trainer. She didn't want to have any sort of that weakness in the abdominal wall. And she was planning to go on a triathlon, which means she would go cycling, jogging, running, and swimming. And she wanted to continue her swimming lessons. If she has a hysterectomy, she'll be off all this training activity for a month, off work for a month. And also she'll be end up with a big wound and a scar, which means she can't go for swimming. So clearly she thought hysterectomy is not for me. And she came to us at Miyot for treatment, and we successfully did the treatment for her. 3rd day she went home. 4th day we called her just to check, because normally we send them home very early, right? 3rd day is very soon after procedure. So we called them on the 4th day to check, and she told, doctor, I've just come back from 10 kilometers of cycling and I'm fine. And all my friends are shocked, because all of them were expecting to come and see me in the hospital. And they were shocked to see me joining them for the cycling trip. So that's the level of recovery you can get with this treatment, because there's very minimally invasive, there's minimal disruption to your general body anatomy. There's no major disruption, so they can go on back to their fitness activities as soon as they can. And this is something you can't even imagine if you had a hysterectomy. Forget open hysterectomy, even if you had a laparoscopic hysterectomy, still you're advised not to lift heavy weights or do any fitness activity for 1 month. So this lady was back to cycling just 4 days after her fibroid embolization procedure. Just miraculous. So this red circle highlights the uterine fibroid here within the uterus. And here you can see the fibroid has almost shrunk in size and almost disappeared after her treatment. So just to summarize, at Miyot, we provide a very, very simple, uncomplicated treatment for fibroids through a pinhole access, which can 100% cure your fibroids without going through surgery or the side effects of surgery. And it's not just for fibroids. We, as an interventional radiologist, we provide similar treatments for different parts of the body, I think it'll be very, it'll be beyond the scope of this presentation to talk about all the treatments we do. But what's a message I would like to tell? One message I would like to tell is, if you have a problem and your doctors advise you surgery, please consult interventional radiologist. See is an option to treat that condition by interventional radiology methods, which means a pinhole method. And obviously for fibroids, it's a very good treatment. The whole reason of doing this webinar was to create awareness among women, because we know that a lot of women, because all the women we get in our clinic say that they've been putting up with this problem and suffering with this problem for so long, just because they don't want to have a hysterectomy and they want to have an alternate solution. So we really, and this turned out to be a boon for these people. The 42-year-old teacher was literally in tears when she had the treatment, and she felt like she had gone back 10 years in life, and she was back to jogging and everything, which she couldn't imagine, because she was not even going out of her house for 2 weeks in a month. And suddenly she felt she got her life back after this procedure. So it can be a life-changing treatment without any disturbances to your normal lifestyle. And we are running a special dedicated fibroid clinic at Miyot Hospitals from today, from 19th until 24th, where a lot of people who have fibroids or they think they may have fibroids can come to us for consultation and a basic screening package at a discounted rate, so they can benefit from this treatment. And that's all my presentation. Thank you very much for listening.
And thank you, doctor, for elaborating on this non-surgical treatment for fibroids. We will now move on to the question and answer session.
Sure.
How long does embolization procedure take, and how long does a hospital stay does it require on average?
Thank you, Serena, for your question. That's a very common question women ask us. So the procedure approximately lasts at least half an hour. Sorry, half an hour. 1 hour. The procedure lasts roughly 1 hour from the time we start the procedure to end the procedure. And then back to that, they stay on the ward for 3 days. After third day, we discharge them home. And they go back to home on the third day. What to expect after the procedure? They will have some mild crampy pain, like what they have during their periods after the procedure, because the fibroid has just been knocked off his blood supply. So that will be a bit of inflammation there. So they'll have some cramping pain, but nothing like major, like post-surgery. All we do is send them home with painkillers to take, simple painkillers to take, and that's enough to take care of the pain. And after the 5th day, the pain all disappears and they're back to the normal life.
So there are a couple of queries from viewers on what happens to the beads post-surgery.
Okay, these beads are medically sterile, inert beads, as in they don't cause any harm to the body. So these have been researched. So they stay permanently inside the body, inside the blood vessels of the fibroid. So they're not even floating around your body. They have gone and lodged into the tiny blood, because these are like, we're talking about beads in microns. They're like 300 microns in size, which is very, very small. So these beads go and lodge inside the blood vessels of the fibroid. So they stay permanently there, block the blood supply and stay there. They don't come out, but they don't cause any harm because they are very safe, medically safe.
A viewer wants to know, he or she has a relative with fibroids. If she gets treated through this procedure, what are the chances of conceiving in future?
Okay, there has been a scientific study on women who had fibroids and having infertility issues, primarily due to the fibroid. And they've done studies and shown that 30% of them went on to conceive naturally 6 months after treatment, within 6 months of treatment. So as I said earlier, the infertility could be due to a lot of issues, a lot of factors, not just only the fibroid. But if it's only due to the fibroids, yes, the fibroids shrink in size and the uterus, healthy uterus, is left untouched. So they can go on to have normal conception if the only problem is the fibroid causing stopping them from having a baby.
Would the patient have pain during recovery?
There is a mild cramping pain. Just they would normally tell me it's the same pain they get during the period, but not as severe. They get this cramping pain after the procedure, just because we have knocked off the blood supply to the fibroids. There will be some cramping pain, but nothing unmanageable like surgical pain or a big wound pain. It's just like a cramping pain, what they go during the periods. And that is easily settled or resolved with painkillers. And that's the reason we send them, first day or second day, it can be bad. So we keep them in hospital. Third day, we discharge them with painkillers. And in UK, when I used to work, we used to discharge them the next day But in India, we generally tend to keep them for 2-3 days because they have pain, and a lot of times what happens is a lot of doctors, when they go out to general practitioners, they don't know what's happened because they don't know about fibroid embolization, so they wouldn't know how to handle this. So that's the reason we keep them in for 2-3 days, make sure they're all okay, the pain is almost gone, and then send them home. Yeah.
So if you can reiterate a few points on the side effects of the conventional procedures, as you discussed earlier.
So conventional surgery is a major open surgery which involves general anesthesia. General anesthesia as such has risks. They can develop chest infection, all these things. And general anesthesia may not be suitable for some people who have chronic ailments like diabetes and blood pressure or heart problems. This doesn't fit into this group because these are patients who are relatively young. So that's not a major issue. Coming to surgery, during the surgery, there are risks of blood loss because during surgery, a blood vessel in the pelvis can get damaged when they are trying to remove the uterus, or there can be damage to the organs next to the uterus. The bladder, urinary bladder, sits very close to the uterus in front of it. The ureters, the tubes which carry the urine from the kidney to the bladder, also runs close to the uterus. And then there is the bowel right behind the uterus. So there is risk of damage to these structures during the procedure. And immediately after procedure, they have a long, big scar in the abdomen, which means they have lots of pain. Obviously, they've cut open the abdomen and stitches are put in. So there is risk of pain, lots of pain, requiring long, strong painkillers, and to stay in ICU for at least 2 to 3 days until the pain is better. And then post-operatively, it's going to take some time for them to start walking because they have a big wound in the lower abdomen. And they are generally told not to not shower because the wound cannot get wet, and they can't lift heavy weights. And the recovery phase, as I told you, they have to be in hospital for at least a week. And then for them to get back to their full activity where they were before the surgery, it usually takes 1 to 2 months, depending on the size of the fibroid and all these things. And long term, there is a risk of having pelvic floor weakness because when the fibroid is being removed, the pelvic floor strength gets weakened. And over time, they're generally told not to lift heavy weights after having a hysterectomy. A lot of women come and tell me, I've heard all stories. They tell me, no, I don't want to have hysterectomy because I've heard stories from other women who had hysterectomies and having problems with this pelvic floor weakness. What it means is they can have urinary incontinence. When they cough, they leak urine. That's very embarrassing for them. So they can have pelvic floor weakness. They can have prolapse, which means a bladder can slip down or the rectum can slip down beyond the anus and all these things. So they can have long-term complications like that. Yeah, these are the drawbacks of surgery. Yes.
There are a couple of questions on the size of the fibroids. So someone wants to know if this can be done for a fibroid of 18 centimeters in size. 18 centimeters.
18 centimeters, yes. The biggest fibroid we've treated is, size is of around 18 to 20 centimeters. The only criteria for size does not matter for us. We can treat fibroids, much big fibroids as well. It also depends on a patient-to-patient basis. Okay, so we always do a MRI scan before we do this treatment to see. The main criteria for us is to know whether the fibroid is alive or dead. Because what happens in the natural course is the fibroids tend to grow, get bigger, and over time they may die. They become inactive, which means there's no blood flow to them. If there's no blood flow to them, then we can't treat them because we work by blocking the blood flow to the fibroids. The fibroids have become dead or inactive, then our treatment doesn't work. But most of the patients, they are young patients. All these patients have active fibroids, which we can treat. We are talking about a very small proportion of patients. Size is not a criteria. Size only matters if the patient's got a 20 centimeter fibroid, but she wants to conceive. When we do this treatment, the fibroids will shrink to literally half or 1/3 of its size. But 20 centimeters means it'll probably come down to 6 centimeters, which still may be a hindrance for pregnancy. So in a young woman who wants to conceive and has a 20 centimeter fibroid, which is very hard, in rare cases, then we will suggest them to go for surgery. But if she's a 45-year-old woman who's almost reaching menopause, she's had her children, and she wants to have this treatment just to treat the period pain, period symptoms, or the bulge, yes, this treatment will work. So size is not the criteria. The criteria is whether the fibroid is active or dead. That we will do tests to work out before we do the treatment.
Yeah, so a viewer wants to know that I've already undergone laparoscopic procedure to remove 2 fibroids, and I have 3 more left. So can an embolization be done now?
Yes. Again, what we do is we will do a MRI scan to work out size and location of these fibroids. and they are active again, as I mentioned, they have blood flow, we can go and treat them. And the advantage with this treatment is when we do release these particles, they will go to wherever there are active fibroids. Meaning, if she knows she has 3 fibroids left behind, she may have 1 or 2 tiny ones which are not seen on scans, which may be starting to grow now. And so when we treat with fibroid embolization, all these fibroids get treated. So yes, it can work for her. Yes.
Can ovarian cyst of 11 centimeter be also treated without surgery?
Ovarian cyst, there are a lot of reasons women have ovarian cyst. We need to work out the nature of the cyst first. And this is not related to fibroid, but she has ovarian cyst. If it's a simple cyst, yes, we can put a small needle and take out the fluid from the cyst and shrink in its size. That can be done. But if it's due to other reasons, we need to do a scan to work out what's the nature of the cyst before we can offer any treatment via intervention radiology. This is not we do what we do with blood flow. This is something a different treatment. But we need to consult her, see her test what she has done, and do more tests to see what's the nature of the lump before we can advise her. Yes.
So there's a little technical question now. So does embolization cut off the general blood supply to a healthy uterus, which may lead to an ischemic condition?
This is a theoretically, answer is yes, because this is one of the risks of the procedure, because we are releasing particles to block the blood flow to the fibroids, and they can sometimes spill over to the normal healthy uterus as well. But this again is a theoretical risk, because when we release these particles, we are carefully watching on a live stream where the particles are growing. So moment we know the particles are, first we do a angiogram, as I mentioned, with the catheter in place to confirm that we are only hitting the blood vessels supplying the fibroid. Okay, and then when we're releasing these particles, we are watching it live as we do it. So we're carefully watching where the particles are going. If we have a doubt the particles are not going where we want, we will immediately stop. Okay, so the risk of it is very, very minimal, but it's a theoretical risk, because sometimes the blood vessel supplying the fibroid also supplies the normal uterus wall. So we will ensure that we take all the steps to make sure that only the fibroid gets treated. Yes.
So there are 2 viewers who want to know if a malignancy can also be found out. Is there a chance of getting a biopsy report done in this procedure?
Right. We can do a biopsy if you guys want to do a biopsy, but what we normally do is we do an ultrasound scan and we'll do an MRI scan before we do this treatment, because this treatment is not meant for cancerous growths in the uterus. This is mainly meant for fibroids which are non-cancerous growths, as I mentioned. One of the reasons we do the MRI scan is to make sure this lump is just a fibroid, because if the MRI scan shows something different like a cancer, we will tell them, no, you go for surgery. This is not the treatment for you. That's one of the reasons we do the MRI scan as well. So the MRI scan shows any doubts, then we will do a biopsy and refer them for surgical removal, because that uterus needs to come out. But when the MRI scan shows it's clearly a fibroid and there's no suspicious features, then we offer this treatment. Thanks for bringing up this question, because that tells about the cancerous ones. But this treatment is not for cancers. Yeah.
So there are a number of queries on if there's a possibility of fibroids growing after the procedure.
So again, when we treat these fibroids with particles, these particles go to wherever there is active, rich blood supply. So as I mentioned about the earlier case there, she has 2-3 fibroids. It will go to all the 2-3 fibroids, because these fibroids will generally tend to suck up the blood flow. So the particles are going along with the blood flow, just like something leaf going in a river. So they will go towards the fibroids. So even if they have 2-3 tiny fibroids which are not seeing now to the naked eye on the scan, but they will also get treated when you do this treatment. And once these fibroids are treated, the blood flow is blocked with these particles, and the particles stay inside. So these fibroids usually die, and there's very small chance of no chance of these fibroids which are already there coming back. But in future, after the treatment, after a year, she starts growing another fibroid is possible. Yes, but whatever we treat is completely treated. Yes.
So in general, what kind of apprehensions do patients have when they come in for embolization? What questions do they ask you?
Yeah, so I think we went through most of the questions they normally ask, because this is a fairly new procedure. Well, this procedure has been around for nearly since the 1980s, and it's very common in abroad. In India, it's not very common because lack of awareness. And so when they come to us for inquiry, consultation, we explain to them about the procedure. We tell them about the risks. The risks are very minimal, very, very safe procedure. And they do ask us about the same questions, whether the fibroid will grow back, or there's any risk of damage to any of the structures. And those are the main questions. And they ask us, what will happen to my periods after the fibroid? We tell them that your periods will happen as normal as they do, regular cycles. But only thing you'll notice, your periods will be much lighter because that's the problem they come with in the first place. So those are the questions they mainly ask. And they ask whether they can have a normal conception after this treatment. We say yes, they can have it.
So there's a question from a viewer, sir. I'm having a fibroid with size of 7.4 into 7.5. Is it possible or safe to remove the fibroid without hysterectomy?
Yeah, so you can consult the patient. We'll do an ultrasound scan, MRI scan to work out if it's very active fibroid, just like we mentioned. If it is, then we can do treatment, because most of the patients we get have fibroids which are like around 7 to 8 centimeters. The IT lady we talked about, she had multiple fibroids, almost of that size, 5 to 8 centimeters. No, we just showed one, but they have, yes, the short answer is yes.
Yeah. So there are a couple of queries on the treatment cost for the procedure.
Okay, the treatment cost, am I allowed to tell, Laru? Yeah. The treatment can cost around 80,000 to 1 lakh, depending on the number of particles we need to use for this treatment, because some people have very huge fibroids. It can be ranging between 80,000 to 1 lakh for the procedure, and the shorter hospital stays for 3 days. But if you compare the cost with a hysterectomy, 3 days ICU stay, 1 week hospital stay, plus all the disadvantages of surgery we talked about, the recovery time and all these things, this sounds to be much cheaper or much more cost effective to have a fibroid embolization. And here I want to mention that this has been proven in studies abroad, comparing head-to-head studies, comparing fibroid embolization with surgery, and they've shown that this is much more cost effective, the fibroid embolization, because of the shorter hospital stay, and the quality of life is much better, because that's a big factor, because economic costs are also involved. If the patient is going to be off work or not back fully to work for 1 month, that also has an economic impact. So the cost-wise, actually, they found it's been much more cost-effective to have fibroid embolization procedure. Yes.
Is this covered under insurance?
Yes, it is covered under insurance. Most of our patients have it done under insurance. Yes.
So one viewer wants to know, like, how many menstrual cycles will it take for her to see the changes post-procedure?
Usually, the first cycle after her treatment, they will notice changes. They will notice significant improvement. Yes.
So there are a couple of viewers who want to know, other than uterine fibroids. Can I pose the questions?
Sure, please. Yes.
So is there any interventional radiological procedure for hemorrhoids?
Hemorrhoids. There is a new treatment for hemorrhoids where we block the blood flow to the hemorrhoids as well. That's a fairly new treatment. Interventional radiology is a very, recently advancing, rapidly expanding. They are expanding the indications where we do treatments for. Yes, for hemorrhoids as well, there is a treatment where because hemorrhoids again is bulging blood vessels in the anal area, which causes bleeding during the pass motion. So yes, there is a treatment available, but we need to carefully consult them, evaluate them before we offer the treatment. Yes. And just to mention, if patients are interested, viewers are interested to know what other treatments we offer, there's actually like a list of more than 50 or 60 treatments we offer for different conditions. It's listed on our MEOD website under the tab Interventional Radiology. We've listed all the treatments we offer for under Interventional Radiology for a variety of conditions. And patient viewers can please click on the link and look at it for themselves, and then can always send an email to us if they have any queries regarding that.
So another related one, my sister has nodules in a thyroid and was suggested to remove the thyroid. So can a similar treatment be performed for thyroid nodules?
Yes. We recently, actually, Hindu was also there. So we do a treatment called radio frequency ablation for thyroid nodules, and which is a pinhole treatment where we just insert a small needle into the thyroid gland, just like the way she would have had a fine needle aspiration. And just like that, we'll insert a small needle. Needle tip produces heat, which can actually burn the nodules and kill them, and the nodules shrink in size. This treatment is very, very effective, and patients don't need to have a thyroidectomy because they are young. They don't need to have the thyroid removed, and this treatment can be very effective for them. Yes, the answer is yes for them, and they can come and consult us if they want to have the treatment.
What is the actual fibroid size for treating it medically, and can you explain about urinary incontinence in relevance with fibroids?
So the first question was medical treatment.
Yeah, medical management of fibroids.
Okay.
What size
medical management of fibroids is not dependent on the size. It depends on the patient's age, where they are in their reproductive cycle, whether they had they had completed the family and all those things. It's based on that they do this treatment. And medical treatment usually is hormone-based treatment, because we know that the fibroids grow because of the hormonal imbalance, the excessive hormones which make them grow. So what the gynecologists or physicians give is hormone tablets, like oral contraceptive pills, basically to block the hormones. So the fibroids temporarily, shrink in size, and they also stop. They don't have these heavy periods. But it's not a permanent solution for this problem. But it can be for some women who are like almost hitting menopause. If they're 45 or 46 and they're almost close to menopause, then the hormonal treatment will work, because it works for 3 to 6 months, and maybe by another 6 months they may hit menopause, and the problem will get better. Because after menopause, we know that the hormones come down naturally, body stops producing hormones, and the fibroids will tend to shrink in size. So we know that thing for fact, that fibroids grow only during the active phase of the reproductive cycle, as in between 30 to 45, 50 years it grows. After that, it starts shrinking in size, because the hormones are the ones driving their growth. So it may work for some patients, not for many. So it all based on a patient basis. And urinary incontinence we talked about. So as I mentioned, the pelvis is a very small crowded space, the lower abdomen we're talking about, within the bony pelvis, and all of us know. And there the bladder sits in the front, in the middle is the uterus, and behind is the bowel. So it's a very small cramped space. It's just snugly fits everything. The moment the fibroid starts growing, the fibroid tends to bend forward and press on top of the bladder. So when it presses on the bladder, what happens is the bladder gets irritated and there's pressure on the bladder. We all get pressure or sensation to pass urine when the bladder gets full and stretched, right? So the normal capacity of bladder is 400 ml, roughly around 300 to 400 ml. So when it reaches that size, you feel the sensation or urge to pass urine, and you go and pass urine. But what happens these patients is, because the fibroid is also applying pressure and compressing the bladder, the moment you have 100 or 200 ml of urine, you feel that you want to pass urine. So you feel the urge to pass urine, and then you can't hold for long. The moment you feel the urge, you have to rush to the toilet. So it's not urinary incontinence, it's something called urinary urgency. They feel urgent, they have to pass urine, and they end up going to the toilet much more frequently than normal people do, because there is, the bladder capacity is constrained. The incontinence happens after they do surgery. If they have a hysterectomy done, that's when what happens when they remove the uterus is interconnected very closely to the pelvic floor muscles. So the moment they take out the uterus, the pelvic floor gets weakened. And the pelvic floor also plays a very important role in maintaining continence, because normally when we don't realize, when we cough and all, we contract the pelvic muscles by, not intentionally, involuntarily we contract the muscles to hold this sphincters in place. Sphincters are something like constrictors, which close the mouth of the urinary bladder and the anus. So these hold these in place, so you stay continent. But when they have a pelvic floor weakness, that when you cough, the pressure, the pelvic floor is not strong enough to take the pressure, so they start leaking a little bit of urine whenever they cough. And this happens very commonly in women, like getting older. The muscles can get weak, but when you remove the uterus, they get even weaker. They can have all these problems.
There's another question related to the thyroid nodules. Yeah. Some nodules are supposed to be benign. Why should they be removed?
Okay, very good question. So the medical guidelines say that, at least in India, the thyroid guidelines say that if the thyroid nodule is more than 3 centimeters in size, it needs to be removed, because there is a small chance, if you left it like that, they grow bigger and they can turn into cancer. The chance is very small, but generally, because there is a chance in future, they tend to remove half the thyroid gland or the whole thyroid gland, depending on where the nodule is. If they have nodules on both sides of the thyroid gland, then they will remove the whole thyroid gland. But again, I don't recommend this treatment, but I'm telling you this is what happens. That's why the doctors tell you to remove the thyroid gland. And we also do something called fine needle aspiration. We put a small needle and take a sample from the gland or the nodule itself to see whether it's a benign nodule or a malignant nodule. Malignant nodule, there's no questions asked. You have to have it removed. Benign nodules, yes, we can. Now we have an option called radiofrequency ablation, where just without anesthesia, just under local anesthesia, we can put a small needle. Half an hour, you can heat the nodule and shrink it in size. Yeah. So that's the reason. The question was why they have to remove. The reason they have to remove is there's a very, very small chance. Depending on different nodules, have different rates of conversion to cancer. There is a small chance they can convert to cancer. That's why they advise that beyond 3 centimeters size, it's better to remove the nodule. But they can't remove the nodule on its own, so they remove half the thyroid along with it. That's what the surgeons do. Yeah.
Can a similar procedure be done for prostate enlargement?
Yes, we do a procedure called prostate artery embolization. It's exactly similar like what we told for uterine arteries. a lot of older men have the prostate gland, swollen prostate gland, which compresses under urinary tract, and they can't pass urine freely, or they have problems with going to urine very freely, or they have a weak stream passing urine, or some patients even end up with a catheter because they can't pass urine because the urinary pathway is compressed. We again go into the blood flow of the prostate gland and we inject tiny particles again, just like the fibroids, to block the blood flow to it. The prostate gland shrinks in size and releases the pressure on the urinary pathway so you can pass urine. Yes, this treatment can be done for prostate artery as well, prostate enlargement as well. But again, we need to make sure that it's a benign enlargement. So we will evaluate them with scans to make sure it's not a cancer and only a benign enlargement of the prostate. In those cases, this treatment works very well without surgery. Yes.
We'll take a couple of questions more, sir.
Sure.
Can fibroids turn cancerous?
Okay, fibroids per se are benign, and very, 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 very rarely they turn cancerous. Nothing is 100% medical field. So there is a small chance one cell can flip over and turn into a cancer, but the chances are very, very less.
Here's a viewer. I'm having a cyst of 11 centimeter in size and fibroid of 7 centimeters. However, currently leading a healthy life with the running and diet control, hence having normal periods without any pain. Still, do I need to go for any treatment or surgery? There's no discomfort as such.
Okay. So as we also mentioned in the presentation, a lot of women have fibroids. Almost 1 in 2 women have fibroids. Not everybody requires treatment. As long as the fibroid is not causing them any symptoms, we can leave them alone. Regarding a cyst, she has to go and evaluate what sort of cyst is it. She has an ovarian cyst, you mentioned. So you have to go and evaluate and make sure that it's safe. Then she can probably sit on it also, because not have any treatment for it. Just keep it under observation with a doctor, because things can go bigger and all these things. So obviously the sensible advice is to have a healthy lifestyle, healthy working lifestyle, healthy diet, and just don't have to have any treatments. Yes, for now.
So a couple of them want to know, should any food should be avoided in the case of fibroids?
No, with interventional radiology treatments, there are nothing like no restrictions on food or activity after 3 to 4 days of treatment. It just holds good for most of the interventional treatment. That's the advantage of interventional radiology. Because we do pinhole procedures, there's no restrictions on food. Some patients who go on blood thinners, some patients who have blockages in the blood vessels in the leg, we open up the blood vessels to heal the ulcers. Some people have diabetics have wounds in the leg, where we open up the blood vessels and put them on blood thinners. They have dietary restrictions, but as long as we don't put them any treatments, there's no diet restriction.
So within how many days can I go to work post this pinhole procedure?
They can definitely go. We advise them 5 days, they're back to the normal activity. We advise them a week. Basically, like you do a treatment on Monday, Wednesday or Thursday you get discharged. Maybe another 3-4 days after that, maybe by middle of next week, they can go to work.
Can we have your concluding remarks, sir?
Yes, definitely. Thanks all the viewers for the nice questions, and thanks for listening to our presentation. I hope you all enjoyed and got a lot of useful information from this presentation. So just the closing remark is, we are running a fibroid clinic, and since there are a lot of viewers having fibroids asking questions whether this treatment would work for them, we kindly request them to come to our clinic and make avail of this opportunity to get consultation and treatment, possibly at a discounted rate, because I think the hospital is to create the awareness. Even the treatments, they're planning to offer a discount for the treatment as well, the actual fibroid embolization treatment as well. So I kindly encourage all the listeners to inform their friends and colleagues and whoever has issues with these fibroid related symptoms to come and consult us at the clinic. And last comment is about interventional radiology as well. It's a very there's a lot of very little awareness about interventional radiology. As I told you, if you have any medical problem or a surgical problem where the surgeon says you need to have surgery, just like a thyroid, please consult an interventional radiologist to see if they can offer anything without surgery, which is true in most cases. I can't tell you every case. Surgery still has a role, but there are many cases where you can get away without surgery, especially young people or even older people, they can have it. So please refer to our NIOD website. We have a list of all the procedures we offer for different conditions, for different organ systems. That will tell you what procedures we can offer, or you can consult an interventional radiologist for further information. Yes. Thank you.
Thank you, doctor. So that brings us to the end of this webinar. I thank Dr. Karthikeyan for elaborating on the non-surgical procedure for treating fibroids. I thank all the viewers, and I hope the session was beneficial. Thank you all.
Thank you.